Uh, Thank you all for attending today. The COVID landscape has changed rapidly in the last few days, and here at Grand Valley, we need to further strengthen our already robust health and safety plan for the fall semester. I will outline our strategy of testing, masking, and vaccinations, which are all mutually supportive, like three legs of a stool, and when combined are our best approach to having a safe campus this fall. Here are the details. Beginning Monday, August 9th, anyone entering Grand Valley State University buildings for any reason must wear a face covering or a mask, as they're commonly referred. This requirement will apply to faculty, staff, students, visitors, and contractors. There are limited exceptions for private offices, dorm rooms, when eating, and similar circumstances. This requirement will remain in effect until further notice. With full FDA approval of a vaccine expected by Labor Day, we are also going to require all faculty, staff, and students to be vaccinated against COVID-19 by September 30th. There will be limited exceptions allowed for religious and health reasons, but this mandate is clearly coming and it's coming soon. Therefore, we ask everyone in our community to get vaccinated as soon as possible. And then those not vaccinated will need to be tested for COVID-19 weekly until they are vaccinated. As of today, about 80% of our faculty and staff tell us that they're vaccinated. And of those students who've reported their status on their self-assessment, about 60% have had at least one shot. We can and must do better. We have a data gap because not everybody has indicated one way or another if they've been vaccinated, and that's another requirement they need to tell us. Free vaccines are widely available from healthcare providers, pharmacies, and county health departments now. But here at Grand Valley, we will offer free vaccine clinics on campus when move-in begins on August 24th during that week, and then as the first week of classes. We've had similar vaccine clinics on campus during the summer, targeting various groups as they have returned to campus, and they've been very successful. And so with that, I'll turn it over to you, Dottie, and questions.
Thank you, Greg. So if you have questions of Greg, you may now go ahead.
Hey, Greg, this is Melissa Frick with MLive and the Grand Rapids Press. What will be the consequences for those who do not get vaccinated by September?
Yeah, sure thing. We're still working on that. We have a number of options for both students, faculty, and staff. Our hope is that most of them will get vaccinated and this will become a non-issue. Of course, there are people that, for various reasons, will not get vaccinated beyond the exemptions that we're going to allow for medical and religious reasons. And we will look to do a number of steps. The first step is not going to be to terminate their employment or anything like that. There'll be several steps of escalation when engaging with these people. But clearly, that I think in the end, if they're absolutely refusing to get vaccinated, we would expect them to seek their education elsewhere or employment elsewhere. But again, there's going to be many steps in that process, I think, before we get to that. And we hope with engagement and education and understanding that we won't have to get there.
Greg, Joe Lafergie with Channel 8. I apologize, I missed the first few minutes or first minute or so. What's the steps for enforcing this? What's the timeline?
Well, we fully expect FDA approval of the vaccine by Labor Day, and then our deadline for getting vaccinated for our students, faculty, and staff is the 30th of September. As far as masks, those go into effect on Monday, August 9th, and the same thing for testing weekly of those that are unvaccinated.
Follow-up question is, this is such a divisive issue in this country right now. Did that divisiveness, did that play into your decision? Did you weigh that decision at all before coming up with this plan?
We engaged across our campus community, both students, faculty, staff, employment groups, in very deliberative consultations. You're absolutely right. There are people on both ends, both ends of the spectrum and everywhere in the middle, absolutely, on the vaccines. But where our focus is we want to have the safest campus we can, and which is consistent with our mission. Our mission is providing education. We have a number of first-generation students that on our campus, and they may need, and others may need, they've got questions that they want answered, and we're an educational institution, and we're here to provide those answers and to, help everyone move forward with this. But it comes down fundamentally to, we want to have the safest campus we can, consistent with our mission to provide education.
Greg, my name is Chris. I'm with News Channel 3 in Kalamazoo. You mentioned everyone has to be vaccinated by September 30th. What's the process of kind of making sure that they are vaccinated? Are there steps to check, or how does that work?
Sure thing. We have a self-assessment that people are required to fill out every time they come on campus. And in that, we ask for vaccination status, and then also so they can self-report it. And then in addition, they can upload a picture of their vaccination card, as an example, and to show proof. And then we can cross-check that with some databases with the health department. So that's how we're going to be able to tell for sure if people are vaccinated, to ensure compliance.
Greg Patrick, Center, WGVU. I'm just curious, what has been the price tag on testing over the past year? And then I have a follow-up once you answer that question.
Sure thing. In the past year, we've conducted close to 90,000 tests. Our testing has gone in, 3 different phases with different providers, and then different types of testing. Right now, our testing is running about, it's somewhere in the order of about $5 to $10 a test. So it's very affordable right now.
All right, so it's affordable. However, there are vaccines out there that are available. Will the university continue to pick up the tab for those who are unvaccinated, or will they have to pay for the testing?
Well, we expect everybody to be vaccinated by the 30th of September. We'll continue to provide weekly tests for those that are unvaccinated. But we're hoping that we anticipate that the number of unvaccinated people that we will need to test will drop significantly in the coming weeks.
We have just a couple moments left. Any final questions before we end this news conference?
So go ahead.
Oh, I was just going to ask, what would your response be, I guess, to like students and faculty and staff who really believe that the COVID-19 vaccine should be a choice, not a mandate?
Well, our reply to that is, we're doing what we can to make our campus the safest place that we can make it for the fall semester. For those, just as many people that feel it should remain a choice, there are other people that feel that it should be required because of the nature of what we do on our campus. We want to make this campus as safe as possible. And again, right now with the Delta variant, if you look at the statistics nationwide, it's real. The spread of the virus it's an issue for unvaccinated people, much greater than 90% of the cases.
Prior to today's announcement of the policies, were there any feedback from faculty or students on kind of what their hopes were for this?
Absolutely. We had very deliberative discussions with faculty, with students, with employee groups. That throughout the past week, as we worked to formulate this policy, we brought in their feedback, their concerns, and engaged in discussions across our entire campus community. That's really the backbone of what we call shared governance here in higher education. And we did that throughout this past week as we nailed down this policy. But that's been an ongoing discussion throughout the past 18 months or so, or 16 months of the virus here in West Michigan. We've being on the virus action team, we've been in this fight every day for just the virus action team was stood up over a year ago, and we've been meeting every weekday since then. And so we've been constantly engaged. Our community has made their concerns known to us throughout. And we feel that this policy here, again, it's a three-legged stool with testing, masking, and the vaccine mandate. This is our best approach to make our campus as safe as possible so we can accomplish our mission and deliver education to our students.
Thank you, Vice President Saniel, and thank you all for joining us today. Have a great day.